First of all, I just need to introduce a small introduction, and then the stage is yours, Dr. Muhammad. Okay, so first of all, let us introduce Chain of Education. Chain of Education, it's a community-driven initiative dedicated to bridge the gap between the students and the valuable educational resources. We collaborate with a wide network of institutions and organizations to create meaningful learning opportunities for students. Through our partnerships, we provide access to high-quality talks such as this talk and other talks, workshops, discussion inspired by leading platforms such as Harvard, Osmosis, Yali, and etc. Our mission is to empower students with knowledge, connect them with experts, and foster a culture of continuous learning and growth. At Chain of Education, we believe that education should be accessible, engaging, and impactful to make that a reality for every student in our community. Okay, so a little bit about Dr. Muhammad, and he's gonna continue. He is an MBBS, MRCC. He is a surgeon resident at the UK, and he is a content creator. And Dr. Muhammad can tell us more about himself.
Hi everyone. I wish I can see you all, but obviously we start hearing each other. So yeah, thank you, Yusuf. As Yusuf was saying, my name is Mohammad Shishtawi. I'm a doctor. I'm currently a surgical resident in the UK. I graduated in 2020, finished my internship in 2021. After that, I moved straight to the UK. Did not work. I'm from Jordan. I did not work there, unfortunately. I just studied there, but I get the chance to move to the UK straight away. I did a few months in trauma and orthopedic surgery. I didn't like it. And then I moved to general surgery. I worked there as a junior clinical fellow. And then I did my exams, as Yusuf mentioned, MRCS. I passed both parts. And after that, I got promoted to senior clinical fellow. So currently, I work as a registrar in general surgery in the UK.
Okay, that's amazing, Dr. Muhammad. So I think we should start with our questions and our talk.
Sure.
Okay, so first of all, we're gonna start like with the opening and the background of you. So can you walk us through your journey from Jordan till the UK? How it did you pass? What did you do? And all this stuff, first of all.
Yeah, so basically, as I mentioned earlier, I graduated in 2020. During my internship year, I did my PLAB exams. So PLAB exams, there are two exams which give you something called GMC registration. After that, you'd be able to apply for jobs in the UK. So there are two parts. PLAB 1 is a theory exam. PLAB 2 is an OSCE. After you pass them, you'd be able to do an English exam, which is called OET. After passing all three exams, you'd be able to apply for GMC registration. GMC stands for General Medical Council. After you are fully GMC registered, you'd be able to apply for jobs. So that's exactly what I did. I applied for jobs, and I got a job offer in trauma and orthopedic surgery. I did 6 months, and then in the UK, the same hospital, I got another job in general surgery. During my time in general surgery, I finished the higher exams, which are called MRCS, which stands for Membership of the Royal College of Surgeons. There are also two exams. MRCS Part A is a theory exam, and Part B is an OSCE type exam. After you finish them, you'd be considered a higher level or a registrar level. So I applied to a trust grade job in the same health board and got promoted to senior clinical fellow in general surgery. So that's briefly it.
That's
Yeah,
amazing.
yeah.
Okay, so doctor, at what point did you decide to pursue the UK pathway? And when did you feel like I need to go to the UK? I decided to go to the UK. Like at what time exactly?
Yeah, so it started so it started when I was a kid. Actually, I used to like Harry
Ah,
Potter a lot, so I thought I want to live
that's
that
nice.
movie. Yeah. So reality is much different than that. So it's not like a Harry Potter movie here. Anyway, my brother lives
Mhm.
in the UK, so I visited him a few times before I came to the UK. And then when I was in my fifth year medical school, I'm not sure where are you guys from, but in
We
Jordan,
have like from many countries,
many
I think
countries.
so.
So in Jordan, I think in many countries as well, there will be like a program which we can take 2 months as elective. We can choose any
Electives, yeah.
hospital, yeah, any hospital in the world that we can do an elective in. So I didn't know, like I wanted to do my residency abroad, either in the UK or in the US. So I did 1 month each. The first month
That's good.
I went to New York in Manhattan. I did a month in internal medicine, and then the second month I came here. I did surgery in the UK. I just liked it more, so that's the main thing that made me choose UK over anything else. The other reason is that obviously, as I said, I'm from Jordan. UK is 5 hours away by
Hmm.
plane. USA is like 12 hours plus.
Much
So
more.
yeah, and the last thing, obviously, I need to stay close to my family, so that gives me the chance to visit Jordan more. I visit Jordan like 3 times a year, and in the UK you get more annual leaves than the US. So it's yeah, it's like a personal preference. All I think like all countries are good, whether you wanna do your residency in your own country, you wanna go to the UK, Germany, USA, any country, but it's like a personal preference at the end of the day.
Okay, that's great. So, Doctor, we have a question in the chats before we move into another topic.
Sure.
Bashir Mustafa asked you, like, did you pass the exams? It was in Jordan, or it's mandatory to go to the UK to do the exam?
Which exams, PLAB or
Like that,
MRCS?
like I think the PLAB
PLABs,
first,
PLABs,
then
right? So yeah, so PLAB one in Jordan we didn't have any centers for PLAB. I'm not sure if there's a center for PLAB these days, but definitely there wasn't one there. PLAB one I did it in UAE, so I traveled there, and then PLAB two there's a center in Manchester which you have to travel to the UK to do the OSCE exam.
Mhm.
Okay.
Oh, okay. So now our second part of the question is understanding the pathway. Like, can you just give us how the typical timeline look from graduation to specialization? Like, how did you pass? Like, the timeline we need for it.
Fine. So timeline for residency or timeline for graduation
Like
or
from once you finished, like once you graduated till
yeah,
you've reached now what you reached.
fine. So yeah, after graduation, as I told you, I did my exams. Ideally, so let's not talk about me. I'm gonna say answer this question in general.
Yeah.
How the pathway works for residency in the UK. So residency in the UK is called training, right? And it's a bit different from other countries. So, for example, if you want to compare to the USA, if you match in the USA, you start
Mhm.
your residency program. However, in the UK, there are two options. You can be in a non-training job, and you can get into training. So after graduation, after GMC registration, you'd be able to apply for non-training jobs. And while you're here, you can sign some competencies like paperwork, and that will grant you the permission to apply for training to go through training pathway. So training pathway in general for for surgery, let's say, people here in the UK do 5 years of medical school. After that, they do 2 foundation years, which are equivalent to our internship year. After that, they'd be able to apply for training. So they do 2 years of core surgical training, and
Mhm.
after that, so that's called core surgical training one, then core surgical training two. After that, they apply for specialty training, let's say for in general surgery, and this is a 6 years program after the 2 years. So ST3 up until ST8, and that's when you become a consultant. Um, Obviously, it's a very long journey,
Mhm.
but
As medicine, it's
yeah,
typical.
medicine. So yeah, so the thing that people don't understand is that in the UK, when you finish as a consultant.
Mm-hmm.
So there's nothing between like as a specialty doctor. So it's pretty much the same, I would say, as other countries. You have to do more exams, like fellowship exams, while you're doing ST3 up until ST8. And when we say general surgery here in the UK, it's more. It can be either upper GI, lower GI, breast transplant, endocrine. So it's a lot of surgeries. And in the last 2 years of the specialty training, you apply for that specific
Mm-hmm.
subspecialty.
Okay. So, Dr. Muhammad, if you could restart your journey, what would you do earlier as a med student?
As a med student, I would definitely work more on my portfolio because that would help me get into training or get jobs easier when I graduate. How to work on your portfolio or your CV. As a med
Mm-hmm.
student, you can just get involved in audits. I assume everybody knows what an audit means. If anyone doesn't know, just let us know in the questions. You can get involved in research and publish some papers, um, do some teaching, and get a certificate for that teaching that you did,
Mm-hmm.
whatever teaching. So you can do teaching for your colleagues on, let's say, how to cannulate or how to take bloods. Um, so yeah, basically portfolio stuff, teaching, audits, publication, research, and that's pretty much it.
So this is what we actually offer in Chain of Education. This is our main
Yeah,
goal is to like enhance the portfolio of the students, hopefully.
exactly.
Okay. So regarding cost now, lifestyle, and the work reality, what is the financial cost of pursuing such pathway? The
Okay.
cost, the
Uh, so I can't remember the exact numbers, but I'm gonna give you like briefly.
like
So I
estimation.
estimation. So I talked about a few exams. So starting with PLAB one, I think it costs like when I did it, it used to cost like 600, 700 pounds.
Mm-hmm.
Um, okay, I'm gonna tell you about what audits mean after answering this question. Um, so 600, 700 pounds for PLAB one, and
Mm-hmm.
you have to travel and you have to find somewhere to stay, like accommodation,
Pay.
and you have to eat. So,
Exactly.
so I would say like PLAB one, and if you want to take a course or something like that, or like PLAB one would cost between like 1,200 to 1,500 if you want to
Mm-hmm.
travel and do the exam abroad.
Mm-hmm.
Obviously, if you're in a place where they do the exam, so you only have to worry about the exam cost, which is around 700 pounds.
Mm-hmm.
So that's for PLAB one. PLAB two costs a bit more. It costs roughly around 1,000 pounds, and you definitely have to travel to do that. You have to travel to the UK, so
So
you
the
have
issues of
to
visa and this stuff.
visa, yeah, visa, ticket, and accommodation, food. UK is a pretty much like UK is an expensive country, so I would say 2,000 pounds
Mm-hmm.
minimum. So and then you have to take the exam, the English exam, which is OET, which is around 500 pounds. So just to get GMC registration, you will need
Mm-hmm.
at least, I would say, between 2.5 or like up to 3,000 pounds, which is equivalent to roughly $4,000.
Mm-hmm.
Yeah. So that's for to get all the exam. Some people don't pass from the first time. Some people have
So they
to,
need to recreate.
yeah.
So like once you maybe arrive to UK, you finished all this stuff. Is there more
Mm.
expenses you need to?
Yeah. So obviously, once you arrive to the UK, so they will sponsor your visa.
Mm-hmm.
They will give you like let's say you applied for a job and then you get accepted in that exact job. They will give you a certificate of sponsorship, but that doesn't mean they will pay anything.
Mm-hmm.
So you have to reapply for the visa because it's going to be a different type of visa, and then you have to book your flight, and you have to find a place to rent, like your Airbnb or a flat or hospital accommodation. So all of that you have to pay for it.
Mhm.
So just until you arrive to the hospital, you need at least also another £1,000.
So like an estimation to reach until you start getting at least paid in the UK, you need around like $7,000 approximately.
Roughly.
Okay.
Yeah.
Okay, that's amazing. So we have a question. Like, doctor, I have a question regarding the elective year. We are recommended to have taken the USMLEs or P-Labs before graduation for a higher chance of acceptance. How were you able to score two different clinical rotations in two different systems?
Um, okay. Um, I was supported by my university, and I think I was just a bit lucky actually when I did that. So I had a connection. I had someone in the USA that they offered to give us an observership, and then we worked there. And then one of my hospital doctors has also offered to. He knew because he worked in the UK. He knew someone in the UK that they offered to give us an elective. So yeah, so I just like by speaking to people basically.
Mhm.
Yeah.
So can you explain for us what are the audits before we move on?
Yeah, so an audit is basically means that, let's say, for example, you work in a hospital, and let's say in that hospital, they say that if the patient got admitted, you need to, let's say, for all patients that need get admitted, you need to test them for COVID-19, as an example.
Okay.
So you go into a department, and there's a guideline. The guideline says that you have to test all patients for COVID-19. And you go into a department. This department has 100 patients, and you check if all patients have been tested for COVID-19, and then the results will be that 20% or 20 patients have had this test. So you will say, okay, I did an audit. So what you did, that's called the first cycle audit. So you checked if this hospital is adherent to a certain guideline. You say that I did this audit, and the adherence to that guideline is 20%. You do an intervention, and then you try to teach people that all patients, or teach nurses that all patients that get admitted into that hospital or ward need to be tested for COVID-19. And after that teaching, you do a re-audit, and this is called a second cycle audit, and you check all the patients, another 100 patients after the intervention, how many patients have been actually tested for COVID-19, and then obviously you would have an improvement in the quality. So let's say the first audit was 20%, the second audit cycle is 80%, so you have 60% improvement. And then obviously you can present that and say, look, I have a guideline, I checked if we are adhering to the guideline, and then I did an intervention, and after that I did a quality improvement project. And then you get a certificate on that, and then you can present it in a national or international meeting. So
Mhm.
that's two points for portfolio. And obviously you're actually um, improving the quality in the hospital, and giving patients better care. So that's pretty much what an audit means.
Okay. So, doctor, we have a question from Rodina. Like, since
Yeah.
there is a currently priority law for UK graduates, would you advise us as an IMG students to apply directly for the foundation program, or is it better to go through the trust grade jobs route and sign the CREST form in order to enter surgical selection process more strongly?
Fine. So yeah, regarding the prioritization bill, so it has changed a lot since 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 I joined them. So basically, going the earlier the better. So going through the foundation program, FY1 2, FY1 1, and FY2, and then getting in the system is much better than getting a trust grade job. Even getting a trust grade job is getting much harder these days. However, I have to emphasize that training opportunities for IMGs these days in the UK is much, much, much harder than before. So to get prioritized as an IMG, you either have to be a UK medical graduate. Sorry, like if you are not a citizen in the UK, you have to be a UK graduate, or if you are an IMG, you have to work for 5 years in the NHS, which is too long to get priority. So basically, my advice is if it's between doing a trust grade job or going into foundation, go into foundation. But it would be still hard to get training.
Mhm. So thank you, doctor. So we have also another question in the chat, like, can you enumerate what, like, as a medical student, you do to raise your portfolio to get accepted into a job interview?
Yeah.
Like, just enumerate them.
So audits,
Mhm.
do an audit and then present it, do a presentation, either national or international. Research and publication, do a research, do a paper and publish it. So these are the most like top three things to do. Fourth thing is teaching, do teaching. So these like top four things to do in general as medical student. And if you are interested in a specific specialty, let's say surgery, you can go and attend, surgeries, and then every surgery you attend, log it in your logbook. There's a website called e-logbook that you can keep track of any operations that you were involved in, and that you can show later in the evidence when you apply for training.
Mhm. We also have a lot of questions. Okay, one of them is, what is the most important thing in a portfolio that gives points in the current surgery selection process? Is it publication or audits? And how can we as students collect these points from outside the UK?
Okay, so there are points for audits and there are points for publications. Um so in the when you apply for training, you get asked multiple questions, and you will be rated on each question on a number. Let's say, for example, how many audits have you done? And then you will say, for example, 2 or 3, and you have a maximum mark for that question. Let's say the maximum mark is 3. And there's another question for publication, and the maximum mark for that question is 3. So it's a point system at the end of the day. So the more things that you do, you can show in your portfolio, on your training application, that I've done this and that, and you will be marked for everything. And after that, they will take, for example, the top 100 scores, and then they will take them for an interview. So the more you do, the more you will be able to get an interview and training opportunity. And how can we collect these points from outside Britain? For example, an audit can be done in any hospital in the world. Every hospital ideally should have guidelines, but you can find any guideline and see if your hospital that you are working in any country is adhering to these guidelines. You can do an audit, do 2 cycles, find a consultant or specialty doctor or the HR team to give you a certificate that you did that, and then you can show that as an evidence when you apply for training and for your application.
Okay, thank you, doctor. So now to move to our fourth part actually, it is the unspoken truths. Okay. So what are the biggest regrets people have after choosing this path?
After choosing the UK, you mean?
Yeah.
Um, so some people, or I would say like if someone wants to regret or say like, oh, I should have done this. So the first thing, as I was saying, is that when I started, I didn't know anything about audits or research or portfolio. So that was my first regret. If I knew before, I would have done so much more because I had more free time as a medical student. So that's the first regret.
Mhm.
Second regret, if you wanna be, I'm not gonna say regret, but second thing that or downside, if you chose this path in the UK specifically, is that it's a much longer journey, and the pathway is not very straightforward. So you can be in a non-training job for a few years without progression, and you can be in a non-training job for a few years with progression, like what I did. But getting into training is the optimum solution to finish your training program and become a consultant. So compared to other countries, you would say, oh, maybe I should have worked a bit harder, or like maybe I should have chose another country like the USA, and within 5 years I would have been a specialist, and the pathway would have been clearer than just like going through years without uh, getting into a training job.
Okay, so Doctor, I want to ask you actually a question. It's from me directly. Like
Yeah.
I've heard once, like if you specialize, for example, in Egypt or somewhere like these countries, then after like starting your residency year, you can continue like your residency program in the UK. How much is this accurate or?
I haven't seen anyone that did that actually. Uh, I haven't seen like anyone that started residency in a country and then finished or completed a residency in another hospital in the UK, like a program which is like
Mm.
both affiliated by both
Ah,
hospitals.
exactly. That was I
So I
wanted to
haven't
ask.
seen anything like that. Maybe there's something that I'm not aware of, so I'm not gonna say yes or
Hmm.
no. But what people do after starting residency in other countries, they can get into the UK through the higher exams pathway. So
Hmm.
as I mentioned, we did PLABs. I did PLABs and then got GMC registration. And then while I was here, I did MRCS, which is the higher exams for surgery. The other pathway is to do MRCS directly and then do OET without doing PLABs. You can skip this step and then you can go directly to the UK at a higher level of
Hmm.
job.
Okay. Also, we have a question from Mohammad. Is a letter
Yeah,
of recommendation from a consultant in the UK have a credit for acceptance in a job interview?
no. No, it's not this similar to the USA. I had a letter of recommendation. They used to count it. Oh yeah, maybe he has this doctor has an NHS experience or knows how the NHS works. But reality is, when you do an elective in the UK as a student or even as a doctor, it's called a clinical attachment. You are only an observer. It's an observership. You are not allowed to even like speak to patients. So obviously you can't speak to patients, but I mean,
Mhm.
you can't do anything. So it's just to see how the system works. A few years ago during COVID, when they needed a lot of doctors, maybe that this counted as something because we need a lot of doctors. So anything that makes you a bit better than anyone else is acceptable. But these days, unfortunately, I know people with NHS experience and do clinical attachment, multiple audits, publications, teaching, everything that you can think of, and
Mhm.
they're not even getting an interview. So the quick answer is no, unfortunately.
Okay, so our last question. Is the UK pathway still worth it today? Like, honestly, how did you answer? After all the changes, all the stuff happening, is it
Yeah.
worth it today?
So is it worth the hustle, if we think about it? So the problem is that um, there's still some luck, but we can talk about numbers. So there are so many doctors in the UK currently trying to apply for training, either IMGs or even British graduates. So
Mhm.
that's how competitive things are getting. So even the British doctors or UK graduates are not getting training interviews, and even some people get into training. As I told you, you do 2 years of surgical training and then you have to apply to specialty training. They do 2 years of training and they get stuck. They're not even getting interview. So it is that hard. So is it worth it? The short answer, I'm gonna be honest with you all. Currently, no, but it's still doable if you're like really keen to it. Um, you need to work hard on your portfolio just at least to get an interview or to get a non-training job, and after that, once you're here, you need to wait until 5 years until you are prioritized to get into a training job. So I'm gonna explain it. So basically, if you say there's a training program for a certain specialties that takes 100 trainees every year, okay? So if you got 200 people applied, 100 people who are UK graduates and they will be prioritized, and 100 people who are none in the they are not in the priority group. They will take the 100 people who are prioritized or UK graduates, regardless how much better the other 100 are. You got my point? So
Mhm.
yeah, even if you like scored 100% in your portfolio and your interview and everything, and someone who is UK graduate scored 30%, they will take this person first, and if only there's available spaces, they will start filling from people who are IMGs.
Mhm. Thank you so much, Doctor, for your answer, your honest answer, actually. This, I think, would help a lot of students to rethink of their options and what to do later on.
Yeah.
Okay, so now we can move to the Q&A. Like anyone who can feel free, open his mic, her mic, and ask Dr. Muhammad directly any question if someone has.
Think there's a question from Aya. If I have a gap year, is it difficult for acceptance? It's not really difficult for acceptance. The difficulty will be in the other things that I mentioned earlier. Yeah.
So we have from Jamil a question. Uh, Jamil Mahmoud. Okay, a final year med student from Gaza. What do you think about getting a sign-off catalog, logbook containing all the surgeries that I attended or some of them assisted during the war? Do you think it'll make any differences in the opportunities in the UK?
So, first of all, as I told you about the e-logbook, uh, the about the training programs in particular, they ask about certain surgeries. So if you are applying for core surgical training, they ask about you have to be involved in up to 40 surgeries, 40, and that will give you the maximum number. So that's to get into first year of surgical training. If you're gonna apply for higher surgical specialties, you will need to choose what specialty. So if you want to apply for general surgery, they ask about how many appendectomies or appendectomies or you have done. So the maximum number is 50 of them, and that will give you the maximum points. If you're applying for urology, it's something else. If you're applying for trauma and orthopedics, it's something else. So every specialty asks you about how many operations related to that specialty have you done. And signing that lookbook can be beneficial if that it is related to that specialty.
Okay, thank you so much, Doctor. Do we have any questions? Okay. If anyone has, you can just open your mic and just ask directly. Okay, I think no more questions. Thank you, Dr. Muhammad, for this amazing talk. We have a question before.
Yeah.
So, in the light of the current high level of competition, what makes an Arab medical student's portfolio truly stand out to residents in the UK? Are there specific courses you would recommend while we are still students?
Um, uh, as I mentioned, the previous thing that I told you about the UK, the audience presentations, publications, teaching, and lookbook. So that's the portfolio part of it. Courses, I'm not sure if you can do it as a medical student, but once you graduate, there are courses there are courses specific for all every specialty. For example, for surgery, you can do a course called Basic Surgical Skills or ATLS. ALS in general is a really good course as well, but it needs to be UK affiliated or something. Um, so that's pretty much it. But given the new priority bill, it's really hard to stand out. Even if you stand out, they have priority to get a training post.
Okay. In terms of your day-to-day routine, is it difficult to balance everything as of now?
To balance everything as well,
I think.
no, it's not really. Yeah, so that's one of the actually one of the upsides of the UK. Why I chose UK over USA is that, let's say, on calls here are only to a 12-hour shift, either day or night. So there's no such thing as a 24 or 36 hours where you stay in the hospital for 2 days and you don't see your family.
Mhm.
So I just leave. I start work at 8 and finish at 9 p.m. And that's only when I'm on call. When I'm not on call, I start at 8 and finish at 5 p.m. So it's not really difficult. Work-life balance is a bit better than other countries, but you have to pay that with all the longer years that you have to keep
Mhm.
training for. Yeah.
And we have a question. What's the best year to decide which specialty to choose?
I mean, there's no best year. I'm not sure how the program in your university is, but we used to do 3 years of theory and 3 years of clinical. So usually in the clinical years where you actually get exposed to that specialty, and then you get attracted to a certain lifestyle or specialty, and then you choose it. So basically, in the clinical years.
Mhm. Okay. How many surgeries minimally could I register in logbook to stand out in a competition in surgery job interviews?
So, as I said, for core surgical training or like for first year of surgery, up to 40 surgeries, it gives you the maximum number. This might have changed, but I'm not sure. So you can go into Google and ask about like core surgical training criteria for 2026, and you can ask about write the word shortlisting score and read about all the things that you need to do, and all of these things will give you points. The more points you get, the higher the chance you'll get an interview. Once you get an interview, there's 30% chance that you get the training offer.
Okay, we have another question. Doctor, do you have any information about dermatology and is it really highly competitive and difficult to get accepted into?
Yeah, what do you think? It's dermatology. Everything in the UK is getting really, really competitive. Dermatology worldwide is competitive, is known to be competitive. So, yeah, it's really competitive. What I know is that I think you have to get into internal medicine training, IMT, and then you apply for dermatology. Uh, I'm not 100% sure. I don't have a lot of information, but yes, it is competitive.
Okay, so Do we have any more questions? Okay. I think that it is, Dr. Muhammad. Thank you so much for this amazing talk again.
No problem.
And
Pleasure.
of course, now we need to take our memory picture, which is something at Chain. We always make it.
Of course.
So if you can, guys, open your cam and take the picture. Okay, here's Jamil. We need other you guys. Mohammad. Team. Okay, can someone from the team take the screenshot? Okay.
Did you take it? Should I stop smiling?
No. Once we're gonna count till, like, since I can't see all the people who opened their cam, so I need someone to. Dr. Anwar, can you make it? We can't hear you.
Can you hear me now?
Yes.
Sorry about that. All right, so I said we're gonna take a memory picture on the count of 3 if everyone is ready. 1, 2. All right, perfect.
Thank you.
Okay, thank you everyone for attending this session.
Thank you so much, everyone. Obviously, if anyone has any questions, feel free to get in touch with me directly or with Yusuf, and he can pass any further
For sure.
questions. I'm happy to help all of you. It was really nice to meet you guys, and good luck with your careers.
Thank you so much, Doctor, for this amazing session.
No problem. Thank you.
Bye bye.